Laguna Honda is really special because of its rich history of service, and that service is rooted in resident-centered care, addressing the needs of the whole person. It's served generations of people probably in some pretty dire times of need. For more than 150 years, Laguna Honda has sort of woven itself into San Francisco's history. When we heard that Laguna Honda didn't regain our certification, our hearts sank.
In April 2022, the Centers for Medicare and Medicaid, known as CMS, took away Laguna Honda's participation in its programs, which is extremely devastating. Participation in the CMS program is the way that Laguna Honda is funded and able to keep its doors open. Laguna Honda takes that very seriously, and we report incidents appropriately. And as processed, CMS and CDPH come out to review those facility reported incidences. What happens during that is an enforcement cycle begins, and this cycle is only 6 months. So anytime there is a deficiency noted, you have to train all your staff, and the expectation is that you're getting 100% of staff with every training, and the entire time the clock is ticking. There's no pause on the clock.
Our office's legal strategy to figure out that we could sue the federal government and the actual lawsuit itself was an important part in allowing the facility to not transfer any more residents out of the facility, and also to buy additional time and funding for another year to allow the facility to do all the important changes that were necessary to recertify in Medicare and Medicaid. The settlement agreement didn't just extend the funding and the pause on transfers, it also set out fairly stringent requirements for improvements that Laguna Honda had to do. CMS and CDPH would survey the facility, which means they would come out and inspect the facility. So any sort of interpretation and advice around the surveys, around interpreting the laws and regulations that apply to the facility, we were all assisting with.
So after each survey that we had, we identified gaps in knowledge that needed to be closed before our next monitoring survey. The turnaround was pretty intense, but we had to do it because of our timeline with the recertification. And we had 1,300 staff on average go through different modules. Everyone has a role in this building to help contribute to the best care of our residents. Porters, kitchen staff, security, people who aren't traditionally thought of in skilled nursing facilities, who are a huge support to all of the clinical care. And it was really exciting to watch the whole community come together.
The relationships with our federal and state partners, the Centers for Medicare and Medicaid Services and the California Department of Public Health, so important. The open lines of communication that we had with them from the very beginning is going to serve Laguna Honda very well, in its long-term success.
Congratulations to our teams from the Department of Public Health and the City Attorney's Office for leading the fight to save Laguna Honda Hospital.
Together, you help secure the future of a critical piece of our healthcare safety net.
We celebrate our frontline staff at Laguna Honda and our union partners.
And we are in awe of your heroic fight and for responding to such a challenging situation with such grace, compassion, and tenacity.
Gratitude to Laguna Honda residents and their loved ones for their support throughout recertification.
The future is bright for Laguna Honda Hospital.
Congratulations.